Hello, and welcome to CRPS Contender, my complex regional pain syndrome education channel. Today's video is Congested Capillaries, Ischemia-Reperfusion injuries and traumatic vasospasms, a simplified overview of Coderre's hypothesis. This video is the companion piece to Microvessel Malfunction, which is a much longer, more in-depth overview of Coderre's hypothesis. So if that one was too intense for you, or it was too long and you couldn't concentrate, or it was just a little too jargon heavy, this one should be easier to understand as well as being much shorter. But it is basically covering the same content. If you get through with this one and you would like to go more in depth, I will link it at the end. This video is based on two different papers which talk about the same thing. I have combined these papers and compressed and condensed them, but this video is based on complex regional pain syndrome, what's in a name, and a hypothesis for the cause of complex regional pain syndrome type 1, reflex sympathetic dystrophy, pain due to deep tissue microvascular pathology. Both of these papers were written in 2010. The first one was written by Terence Coderre, who is the director of the Pain Research Laboratory at McGill University, as well as a member of the McGill Center for the Research on Pain. The second paper was written with the assistance of Gary Bennett, who is a professor of global health and medicine at Duke, as well as the director of Duke's Global Digital Health Science Center. Now, before I get into this, I do want to be clear that I personally, CRPS Contender, am not 100% behind this hypothesis. I think the physiological aspects of it totally hold water. I think it has a lot of great content, and we should take the content and the hypothesis that they have proposed and have good basis for, and apply it to a bit broader hypothesis. But point being, I just don't think they go quite far enough. But overall, I do support what they're saying. I just think it needs to be a bit more broad, and the hypothesis that I personally support does incorporate this content into it. With that out of the way, let's get started here. And I tried to include lots of pictures in this one to help make it easier to understand for visual learners. So, first thing, in CRPS, there's usually an injury, not always, but in most cases, there is some sort of injury to soft tissues. This injury causes an increased blood flow and blood vessel permeability, allowing things to cross from inside the blood vessels to outside, leading to swelling and an increased fluid pressure in the interstitial space outside of the blood vessels. Now, if you look at this picture over here, this is showing you a picture of the lower leg, but the concept applies to the entire body. You can see there are little compartments here surrounded by a connective tissue called fascia. And inside this connective tissue, there's nerves, arteries, veins, and muscles. When there is fluid that leaks outside in between the cells and the vessels, there's something called interstitial space. And this space often fills with fluid, which is usually blood plasma. And this then becomes interstitial fluid. This is how oxygen gets to your cells and other things as well, but mainly oxygen. And then your capillaries, veins, and your lymphatic system is then responsible for recollecting that interstitial fluid and recirculating it, cleaning it, and making sure everything in there is all right. However, sometimes this fluid does not get picked back up, and this causes the intracompartmental pressure to increase. When you hit a pressure of 12 millimeters of mercury or higher, this starts to cause a compartment-like syndrome. Normally, inside the compartments, pressure is between 0 and 8 millimeters of mercury. Now, acute compartment syndrome, which often leads to tissue necrosis, which is death if this is a severe or immediate medical emergency, is about 70 millimeters of pressure. But it really starts becoming a problem with intense warning signs around 45. But you only need 12 millimeters of mercury to make it so that over 50% of the capillaries can no longer allow fresh blood out to get into the tissues to deliver oxygen. The higher that pressure goes, the more those small vessels going from tiny arterioles, which are the smallest arteries that you have, your capillaries, which is that net-like structure that allows blood out, and your venules, which are the counterpart to the arterioles, they're little small veins that work with a valve system. The higher up this pressure goes, the more of those vessels get blocked so that things cannot pass through. This means that there's reduced blood flow and a reduced amount of oxygen. This can also cause these compartments to swell and increase, as you can see in the upper right corner of this compartment syndrome graph. These dysfunctional vessels lead to ischemia, which is an insufficient supply of oxygenated blood to the tissues in the affected area, causing anaerobic respiration and mitochondrial dysfunction. Now, your mitochondria, as you probably know, is the powerhouse of the cell. However, it is aerobic, which means it requires oxygen to do its job. If it is not receiving oxygen, you have to utilize anaerobic respiration, which does not use oxygen. When you're using aerobic ATP production, energy production, you're usually getting per glucose molecule about 30 molecules of ATP. However, when you're using anaerobic respiration, you're only getting about 2 net ATP. It actually makes more than that, but it costs some energy to make. So in the end, you end up with 2 functional units of ATP to be able to spend on something else. Which means when you are using anaerobic respiration instead of aerobic respiration, you are having 15 times less spending power than you would otherwise. When these vessels spasm, as you can see what that looks like in your upper right corner here, it creates a bottleneck and things end up getting blocked in there. You've got your red blood cells which can block it, which is what you're seeing here, but also you have white blood cells that run through your vessels as well, and these are much larger. You've also got platelets in there, which are the coagulating factor. And all of these kind of get all stuck together and create a blockage so that things can't get through. The capillaries, which are the little tiny net-like structures that allow things out, and venules, which are the tiny little veins, dilate and fill with deoxygenated blood. Some of this leaks out of the veins, increasing the intracompartmental pressure by increasing the amount of fluid in the interstitial space. Once the spasm relaxes and blood rushes back through, this causes a reperfusion injury due to the level of increased oxygen and nitrogen free radicals. Now, this is generally pretty easy to see on your hands, but this also applies to other areas of your body. When things are white, this is your ischemia, which is where things aren't getting through. When things are blue, this is cyanosis, where the deoxygenated blood is sitting there. And then when you have it go bright red again, this is when freshly oxygenated blood is going through extra large vessels to make up for the times when it was blocked. However, this is actually very damaging, and we'll talk about why soon. After the Ischemia-Reperfusion, the release of the vasodilator nitric oxide is greatly reduced, and the nitric oxide that is released is very quickly converted to toxic reactive nitrogen species after it interacts with reactive oxygen species. Free radicals cause damage to endothelial cells, causing swelling. Now, look over here at this image here, because I want to kind of tell you a little bit about how free radicals work. Atoms come together to form molecules, and the outer ring of electrons shares with the atom that it's connected to, creating stable pairs. However, when that molecule breaks apart, one atom is left with an electron that doesn't have a pair. This unstable atom goes to another molecule to steal an electron so that it can be stable. However, this means that that electron that was taken now has left an empty pair. So as one free radical becomes stable, that makes another free radical that is now unstable. And so this creates a chain reaction of losing and taking, losing and taking, losing and taking. Antioxidants are electron donors. So they go and they give electrons to unstable atoms so that they can have pairs and become less damaging. This bottom image here shows the results of oxidative stress. On the left, you have what a normal cell looks like, the free radical damage of the cascade of oxidative stress, and then what happens to the cell after severe oxidative stress. This leads to cell damage and cell death. In your tiny veins, the swelling of these endothelial cells, which are the cells that make up your blood vessels, creates gaps in the walls of your blood vessels. This allows fluid to leak out from your vessels into that interstitial space, which increases your swelling. Free radicals also increase cytokines, which are inflammatory, and white blood cell aggregation and adhesion, which creates plugs and blocks and eventually collapses capillary lumens, which is the empty center of the tube that things move through. Deep tissue ischemia, which is an insufficient supply of oxygenated blood in your muscles, bones, and nerves, occurs. This also happens in your skin. Bone ischemia, occurring around the bone shaft on the outside as well as inside the bone shaft where the marrow is, causes osteoporosis and a deep aching pain sensation. If you feel like you have acid inside your bones or some sort of corrosive, something that's eating away at it, that's this deep tissue ischemia causing your bones to die. Muscle ischemia causes anaerobic ATP production, which creates an increased amount of lactate, tissue acidosis, and skin-level allodynia and hyperalgesia. Now, we already talked a little bit about anaerobic ATP production, and I'll probably do another video on that as well. However, there are lots of good videos out there, so if you want to learn more about this, I definitely recommend checking that out. Anaerobic ATP production produces lactate. So if you are using anaerobic energy production a lot, you're going to have an increased amount of lactate in your system, which is very true for CRPS patients. This can cause acidosis, specifically lactate acidosis, because lactate has a low pH. Symptoms of acidosis you can kind of see over here in the bottom right can have systemic effects, which really just makes you feel like crap. Now, in this picture to the left, you can see these little capsules. What these capsules here are showing, this is something called a trigger point. You might also know this as a muscle knot. Lactate, which is produced during anaerobic respiration. Norepinephrine, which is the major catecholamine used by your sympathetic nervous system. And substance P, which is a pain modulator, all get trapped together in these trigger points and they build up. And we're going to talk more about this later, but I just want to let you know that's something else that happens. And I will also do another video on this at another time. Nerve ischemia causes ectopic activation of A and C pain receptors, as well as degeneration of neural structures and the release of pro-inflammatory cytokines. This kind of happens in two ways. One, your nerves are wrapped in something called endoneurial capillaries, which is just the vessels that come to oxygenate your nerves. When they get blocked, which is very easy to do, particularly in distal small nerves, especially like in your hands and feet, they cause the pain receptors to activate because pain is the alert that there is damage occurring. This can also be activated by the degeneration of muscle and bone, which is also happening. The lack of blood can also degenerate neural structures, causing them to break down, and then the pro-inflammatory cytokine release also does damage, but it also perpetuates the cycle. During the initial onset of CRPS, sympathetic nervous system activity is actually blunted, not increased. However, this leads to alpha-adrenoceptor denervation hypersensitivity, which basically means that because there's less of it, it's more sensitive to it. This causes a threefold contractile increase to norepinephrine. So when that blunted period is over and you go back to a more normal level of sympathetic activity, you are 3 times as sensitive and will have 3 times the response as your standard individual in the contraction of your blood vessels. This causes excessive vasoconstriction to standard levels of sympathetic discharge, sympathetic reflexes, and circulating catecholamines like norepinephrine and epinephrine. C-fiber activation initiates and maintains potent NMDA receptor-mediated central sensitization. Side note, if you take ketamine topically or get infusions, ketamine targets these NMDA receptors to put a halt on that or mitigate it a bit. This means that CRPS has neuropathic pain elements as well as inflammatory pain elements. And this one to the right talks about moving from sympathetically maintained pain to sympathetically independent pain and how chronic pain occurs. Initially, there's an excessive amount of blood, but it's kind of flowing slowly, as well as a high permeability of the blood vessels. This leads to swelling. But as these microvessels become blocked, no reflow occurs, which means blood can't make it through. This means there's arterious venous shunting going on, which is where arteries end up connecting to veins without a capillary bed in between, so that blood can continue to circulate even though it isn't really being dispersed into the tissues that need to be oxygenated. Blood cannot leak out of vessels if there is no blood going through the vessels. This causes cyanosis and atrophy. This may be the answer to the transition from sympathetically maintained pain to sympathetically independent pain, and whether or not CRPS is a stage condition. The slow flow stage would be the sympathetically mediated pain stage, the early stage, the stage with lots of swelling and heat. The no-reflow stage, where things are already blocked off and blood is not making it through, would be the sympathetically independent pain stage, the late stage, where shrinkage occurs and where you are cold. If this is the case, then sympathetic nerve blocks would assist in the vasospasms of the slow flow stage, but it would not be helpful in the capillary occlusion no-reflow stage. Why does reperfusion, the blood being returned, cause damage? Looking in the bottom right now. Initially, you have ischemic conditions where there's not enough blood, and this is causing anaerobic metabolism. Then, suddenly, there's reperfusion with a large influx of oxygen. Oxidative enzymes produce reactive oxygen species, which damage cell membranes, causing cell death. That was a very, very short overview. If you'd like something with more detail, do check out that Microvessel Malfunction video. So what are some things you could do at home to help mitigate the damage from ischemia-reperfusion injuries? Because you can't really make it stop, but can you improve your situation? Yes. So here are some things that can help. Trigger point release. You might also know this as myofascial release, trigger point injections, deep tissue massage, releasing muscle knots. They're all basically doing the same thing here. The point of this is to increase your blood flow, reduce your muscle tension, and allow for the reabsorption of lactate, norepinephrine, and substance P into the system by kind of popping open the capsules that they're in. I will do another video on this, but this is something that you could definitely look up for yourself to learn how to do. They feel like little beads under your skin, basically. My recommendation for this would be to kind of think of your body like a non-Newtonian fluid, where the more force you apply, the more it's going to resist you. My recommendation for this, which is particularly convenient for CRPS, which leads to supersensitivity, be very, very gentle. Just kind of sit there, find a spot, and gently apply some pressure. Less is more. So just sit there and let your body get used to it before you gently apply a little bit. If your body starts to resist you, lighten up a bit. It is not necessary for you to try and, hammer your way in there. That isn't going to work, in my opinion and in my experience. You need to allow your body to relax so that it can release the knots on its own. You're helping it do what it already wants to do, and it just needs some encouragement. But if you go in there and try and bash it over the head with a baseball bat, you're gonna meet resistance. So, cooperation better than coercion. Definitely my recommendation for this. Lymphatic massage. This is to help reduce the amount of interstitial fluid that's in the interstitial space to relieve some of that intracompartmental pressure. You're just stimulating the lymphatic system to help pick up that fluid. Again, this is very, very gentle. And sometimes you don't even actually have to touch yourself. You can just kind of sit upside down, especially if it's in your legs. You can just lay on the floor and stick your legs up on the bed and gently run your fingers down, or not. You can feel it kind of leave a bit. Again, this is something you could look up how to do. Lots of resources out there for this. Consume antioxidants. This is to help mitigate that free radical damage and reduce the amount of free radicals that are in your system. And then stress management. This is to reduce the amount of toxic stress that you're experiencing, as well as your reaction to sympathetic nervous system activation of alpha-adrenoceptors, which cause vasoconstriction because they're hypersensitive. Okay, I think that's everything. Thank you so much for watching. You're welcome to share anything on this channel. If you like what I'm doing here, hit subscribe. If you'd like to contribute to my medical expenses, my Patreon's listed below. As always, relevant sources are linked in the description. If you would like my more complete source sheet, check out the Microvessel Malfunction one. This one is mostly just including the sources to the images that I used, which thanks so much everybody for making those, because I am a terrible artist. So glad I found them. So if you want to see the sources for any of the images, go ahead and check out the source sheet. Okay, thank you so much for giving me your attention. I hope you learned something today, and I hope to see you next time.